A few months ago, when I found out that I needed open heart surgery, I looked on the web and I looked on YouTube and other places, and I couldn't find anything on how to prepare. So here are 15 different things you can do to prepare for open heart surgery. Number one, your number one person. So you'll need to find a consenting number one caretaker person to take care of you, to listen to the doctor, sit with you, keep you in a positive mindset. Someone who's willing to wait for you hand and foot, especially in those early days, those first 5 to 7 days can be really tough. You won't remember anything the nurses say. Record the doctor's meetings, whatever they need to do. Keep those facts straight, medications. Basically, they're in charge because you're in a state of delirium in a bed recovering, and all that anesthesia and stuff is whirling around, and you won't remember the last interaction you had. So have that number one person. For me, I have my wife, who is a project manager. But if you're putting together a crew, one person, say, for transportation, one to sit with you in the hospital, maybe when you get back home, someone to help with light chores, dishes, whatever needs to be done. But just be clear what your needs are ahead of time, and you're going to need to rely on people. And then again, this isn't about the pain or pain management or medication necessarily. It's more about the delirium of coming out of anesthesia, not knowing where you are, having to figure out things again, like how to use the bathroom, how to wash yourself, how to take a shower, how to walk. I was walking with the physical therapist, and I honestly asked, where do I look when I walk? And she said, well, you kind of look forward, you don't look at your feet. I had no idea. That's the kind of state of mind you're in, where you're just kind of relearning and re-understanding what's going on, kind of re-entering the world from this anesthesia. Number two, text chains. This is a real simple one, but have your number one person set up 2 different text chains. One for your family, where you can be a little more intimate with the information, and then one for friends and others that don't necessarily need the nitty-gritty, but just hey, everything's fine, he's out of surgery, whatever it is. So having those 2 avenues of communication, your number one person can talk to a doctor, then relay that information in one way for the family, and then in another way for your friends. Number 3, prepare for impact. Eat and exercise right. Low salt, low fat diet, all the things that your doctor's been telling you forever. Good vitamin intake, get good nutrients, take care of your body. Your body and your heart and everything is about to undergo a major trauma. Set yourself up to be in your best shape and your body in the best condition to prepare for this trauma, because it'll pay off in the recovery. Number 4, setting up your home recovery room. To set up your home recovery room, that means find the best place. It's probably your bedroom, I'm guessing. Get new sheets that you like. Get the right lighting. Get the right curtains, window. Set up that room so it's as pleasant and comfortable as possible, exactly the way you like it. You're going to be spending a lot of time in there, and a lot of time, frankly, on your back for the first few weeks. So make it the way you really want it. Now, when you can really physically do something about it, go out and buy things that you like and make it great. Number 5, your day recovery room. This is kind of related to number 4. It's another recovery room, but it's a place where you can receive people like friends and family. So find a chair, like a lazy boy or a comfortable chair that reclines, something you can sleep in, snooze in, whatever, take naps, watch TV, pass the time, but also in a place like a living room or a family room where you can receive people, and they can bring food over, and you can sit and chat for a while and talk about how it's going. It's great for your mental health. It's a great way to pass the time. Have your number one person set up those times according to what you want by your rules. So it's just a place that's different than your day recovery room, a place where you can watch TV, be with your family and with your friends while you recover and help pass the time. Number 6, visitors. You dictate how long, who, and when your visitors come over, family or friends. Have your number one person explain that very clearly. Even if it's already planned and set up, cancel it. If you don't feel up to it, cancel it. Just tell them you're tired. They'll understand. They're family and friends. They are your best people. They'll get it. And in the hospital, for myself, I didn't want anybody to be in the hospital heart recovery ward and ask me a bunch of questions when I was in a constant state of delirium. They'd be asking my number one person questions. I just didn't think it was a really good thing to visit somebody in the hospital like that when they're right out of heart surgery. So I set it up so people come over to my house rather than go to some hospital room and ask a person that's not me what's going on with me and see me laying down with tubes coming out of me and all that stuff. So I set up that day room so people could bring over food. And it's also important because nobody's really focused on your family, especially if you have kids. It's a great way to engage with the kids, engage with the family, ask questions, talk about stuff. You're down and out. You're going to be snoozing or kind of in and out, especially those early days. So it can really lighten the load for the caretaker, for visitors to bring over food or takeout or whatever it is, and be really clear what your family likes to eat, what they don't like, what would be good. Think about that now rather than when you're in recovery and trying to figure it out or putting more of a load on your caretaker person. Number 7, treating your wounds. So read and understand and watch all the videos you can before going in. An infected surgical wound can be an awful experience. From what I understand, it's called debridement, I think. And they have to open it back up and get all the nasty stuff out of there if it's not taken care of. Get a daily meds container. Take your meds. Keep the wound clean. Be vigilant about it. Take care of it, and you won't have any problems. Number 8, unpleasant smells. The smell of the hospital when I came home kind of drove me crazy. It was on my skin, it was in my clothes. It was kind of like when you drink a lot of tequila and the next morning you smell like tequila and it's in your skin. I felt like I couldn't get away from it. There's just some kind of hospital smell. I couldn't even figure out what it was. So flowers, candles, fresh air, or find a certain soap that's really great. We got rid of most of the things that came home with us from the hospital, even the clothes I was wearing, all that stuff. It just had the stink on it. I can't explain why that is, but if you're sensitive to that thing, take care of it. Be vigilant and set up your own environment to your liking. It'll help a lot. Number 9, your appetite. Even 2 weeks after my surgery, I could feel that I was hungry, but I had no appetite. I'm not really sure why. But for a long time, I didn't want to eat anything. I had, just to get the nurse that I had just suggested, eat anything you can, get any kind of nutrition. Your body is dying for some nutrition. So I had whatever I was hungry for. At the time, it was root beer floats and malted milk and all that stuff, treats and stuff like that. It's the only thing I craved, and it was kind of like I had my number one person at the ready. Like I really could go for some stir fry or something like that, and she ran out and got it for me, and I would eat something because we were both desperate to get some kind of nutrition into my body as my body was healing. Once you get through that, once your appetite comes back, for me it was 10 days after surgery, it can be as much as 14. Once that comes back, then you go to your forever diet, the diet your doctor's been talking about all this time: low fat, low salt, all that great stuff, lots of greens, etc., fruit and vegetables. But for the time being, it's really hard to deal with. That you can feel that you're hungry, but you don't have any appetite. It's the oddest feeling, but it really puts you out of sorts for a while. Number 10, getting back to normal. So it will take about a week to 10 days before you're back to feeling like yourself. The anesthesia takes a long time to get out of your body. You've had to relearn all these things, how to start walking again. I started walking with a cane, getting stronger every day. Basically, every hour that you were under anesthesia, I was told, is about a day of recovery to get it out of your body. So drinking lots of water, eat whatever you can, as much as you can, sleep as much as you can. Anything that can get that stuff out of you and pass the time until you are feeling back to normal. For me, it was exactly 1 week. I got a good night's sleep, I had something to eat, and all of a sudden it was like I woke from a dream and it felt like myself again. So prepare for that. Basically, just know that this is coming up. Number 11, stay positive. There is going to be a lot of discussion leading up to the surgery date, a lot of fear, a lot of curiosity, interest, questions, concerns, worries. All this stuff builds up. It can be really mentally trying. Your body after the surgery is full of drugs and your mind wanders a lot. When I was in the recovery room, when I was alone, I literally spoke out loud positive things. This is great. What a beautiful room. Wow, that light is really beautiful. Because it's really easy while you're in that state for these kind of negative thoughts to get into your mind, like feeling sorry for yourself or wondering why me and why did I do this and what's my life ahead going to be like and all those things. You can really be tempted to go down kind of this dark path of thoughts, especially when you're alone. And you're in this delirium. So whether it takes speaking out loud positively, maybe it's something like I got a gift of a blanket that felt like a teddy bear, and I just thought it was a big teddy bear giving me a hug. It was a really great positive thought for me. It just, any way you can avoid some of those kind of sinister, those creepy thoughts that come in. Even get your number one person to speak positively. When the doctor came in for me, the surgeon came in and said, best possible outcome. It was great. Be prepared for him to not say that, to say we need to go back in, or it didn't work, or we had some limited success, and talk about that with your number one person. How you feel about that and what next steps are, and get your mind set for and expect that, and have a plan on how to approach that and what to do next, and how to talk about it. And overall, just bringing that positivity and that resolve into that room where there's a lot of reasons to feel sorry for yourself, to be honest. Number 12, sleep. You need to sleep on your back for a while, which I never do, but you need to sleep on your back while your sternum heals. So set yourself up for that. I got a big foam wedge and I got pillows, and I set up my recovery room so I'd be able to sleep on my back. I still had trouble. I had a sleep apnea CPAP machine, and if you have apnea, you know that sleeping on your back can really make you snore. So when I had the CPAP on, it was blasting air into me, and I'd wake up at 2 a.m. with air blasting. It was very hard to get used to. So set yourself up for that with your bed and your surroundings. And then beyond that, sleep whenever you can, however you can. On the couch, on your day, in your day chair, your lazy boy, upstairs, or wherever you are in your bedroom. However you can, catch some Z's anytime you can, and tell the people around you, your friends and family, I might knock out at any moment, because you really feel like it, because you're pretty worn out and your body is healing, it's coming back. Number 13 is recovery. This is just telling you, have a plan for your recovery. You need to put time behind you. Find ways to entertain yourself 24/7. You'll be up in the middle of the night, you'll be up in the morning, late at night, all the time. You have 8 to 10, 12 weeks before you're fully recovered. TikTok, YouTube videos, movies, have yourself set up to do passing time. Visitors are especially great. They were in my case. People coming over and telling stories and talking, and even being okay with me falling asleep on them and waking back up and they're still there. But bringing food over and stuff like that is a great way to pass the time. Basically, it's just an incremental recovery, day by day, a little bit better, a little more sleep. My appetite's a little bit back. I can eat more, sleep more, feeling better, walking better, recovery. So any way you can make those days go faster, or just pass the time, is going to be great. So set yourself up for it, and hopefully that will help a lot for your 8 to 10 weeks. Number 14, move your body. Get on your feet, move, stand up, walk around the kitchen table, walk around in the kitchen. It's just any way you can to get your body moving, and it just feels like you're kind of getting that crud out of your body. And beyond that, it'll help you sleep more if you're more active. So whatever you can. For me, I just challenged myself the first few days of just walking around and around the kitchen island in my house, and I did it 4 times, and this time I'll do a 10 challenge. Anything to get you moving, stand up, and get your blood flowing. It helps so much. I can't tell you. I know you're not going to feel like it in those first few days, but get moving. It just has so many rewards and benefits to it. And number 15, those unpleasant reminders. Clean off the tape adhesive on your hands and feet and wherever else. And they use this yellow goop stuff on you that I don't know how to get it off with scrubbing it and stuff, and it sticks to you like crazy glue. Be prepared to have help in the shower. Hopefully you're number one. In my case, it was my wife, so I was okay, but have someone to help you get in and out, to sit down by one of those little bench things to sit down in the shower. Hopefully, maybe you can get a handheld thing. Helps a ton, but you're not going to feel like standing up. It's too dangerous for you to fall. You don't want to fall. But helping getting rid of some of those reminders of the tape and all that stuff, and just get you real nice and clean. And it also gets rid of some of that smell that I swear was with me and still with me. It'll help a lot. It'll put all that stuff in the past and start, help you think about moving into the future. And there it is, 15 different things you can do to prepare for open heart surgery. From there, it's onward. You're on the road to recovery. Come up with your long-term plan for your diet and exercise. Make those changes. Those first few days of recovery are tough, but you can do it, and you have a new lease on life like I do. And good luck. Thanks for watching. Please share.